Hello, everyone, and welcome. My name is Adam Cross, and I'm a licensed marriage and family therapist in Southern California. I'm also the founder of the Catholic Therapy Center, and very excited to be here with one of our clinicians today from the Catholic Therapy Center. And the goal is to provide you, as you're watching this or listening to this, with an idea of what therapy looks like, specifically with Danielle Enriquez today. And so she's going to talk to us about just what it's like to be in therapy, her foundations, the process, what she loves about it, and what she's hoping anyone who works with her is taken away from therapy, whether session by session or just the whole process, what they're walking away with. So Danielle, thanks again for being here. And anything else you want to introduce about yourself?
That's a good question. Well, I'm still going to Beanies a lot. So if you're in Bakersfield, I'm giving a shout out to Beanies again because they keep me caffeinated, which helps me to help my clients. So there we go. If you're ever in Bakersfield, Beanies.
This episode brought to you by Beanies.
Yeah, I know. Like, oh gosh.
That's good. Awesome.
But yeah, just still trying to, follow the path towards eternal salvation, falling many times, trust me, but trying to get back up and trying to bring as many people as I can with me.
And you're still involved with OCIA and administrate your parish?
Absolutely. So still involved with OCIA. We're about to start next week. That's really exciting. And excited for a new year ahead. Just being able to share the love of the Lord with anyone and everyone, especially those who are coming through the program.
Awesome. Cool.
Yeah.
Well, today we're getting a glimpse of therapy with you, what that's like. And obviously it's different because I'm not going to, going into everything in my life and all my feelings, but we're going to capture it in other ways. We're going to ask some good questions and break down this process of therapy and what it looks like with you. And I think what's awesome about therapy is it is so different for each therapist. So there's a lot of things, guidelines, expectations that are consistent, but then each therapist really brings their own touch, their own personality, their own flavor to the experience. So I always enjoy just getting to see how people operate in therapy. I've loved seeing how they do things slightly different. I'm like, oh, wow, that makes a big difference, or this is the same, so it's really cool.
Or, wow, this is something I maybe don't want to do.
Yeah.
I've definitely had that experience. Try not to do that.
I had an experience where I tried out a therapist, and it was a Christian therapist. I don't know what denomination, but I went to him for one session. In that first session, he was trying to convince me that the church did not have authority and that I should not be listening to the bishops and the Pope.
Oh my gosh.
Yeah.
You're like, okay, sir, can we take this outside therapy room?
First session, I was like, what is going on? Peace out. I'm not coming back.
Exactly.
This is not what I want.
That totally speaks to, I feel like, what you're alluding to, like everyone's kind of different flavor, their personality, like being integrated. Catholicism is growing, which is so beautiful. But unfortunately, I feel like there still is a lot of heavy misconceptions about our beautiful faith. It's really hard when you hear people like that talking about the faith in such a negative lens and in a untrue lens.
Yeah, that's really the importance of having a Catholic therapist, especially with specific struggles and crosses we carry, that people understand us and our faith. What is healing? What does it mean to be human? Who is God? What does God want for us? It's not just the faith, it's everything when we take it from that perspective. So, and that's probably a good lead in, or I'll make it a good lead in, but really jumping in. So even before someone's in a room with you, right? Or a Zoom call with you, what has brought you to this work as a therapist? If you could sum that up, why therapy? Why be a therapist?
Absolutely. And so a slight little plug. If you didn't check out the episode about what led me to therapy, go ahead and do that.
Yeah, there you go. That's it.
But if you didn't, then I'll give you a quick recap, which is totally fine. What brought me to the field of marriage and family therapy, or just therapy in general, would definitely be my own struggles with anxiety and not being myself. But all of that to say, Having great friends who called me out graciously led me to pursue therapy with a Christian therapist. She was not Catholic, but she was so good. Did not challenge me on teaching authorities by any way, shape, or form. So I was super grateful for that. But I thought to myself, like, wow, if I can experience this much healing, I want to do that for other people. And so fast forward, I'm like, okay, let me apply to grad school, and the rest is history. But what truly keeps me in this field, it's kind of wild. My old supervisor, she's my old doctoral supervisor. I'm not sure why they called her doctoral supervisor. I did not have my PhD, but that's what they called her. And she told me, yeah, Danielle, the average life of a therapist is only 7 years. And I'm like, oh my, 7 years? I'm thinking, okay, that's a relatively high turnover. As I got more into like past my traineeship and becoming an associate with more hours, thanks be God, like I can kind of like low key see how that 7 years is 7 years. But all of that to say, yes, some days are incredibly hard. Some days are filled with so much joy to see the progress that clients have made. But yeah, there are some days that are super heavy. But all of that to say, what keeps me in this field, what keeps me in this profession is number one, I truly believe is our Heavenly Father. He has placed me here in this career for a reason. I firmly believe that with every fiber of my being. But number two is really to share the love of the Lord with other people and to let them know that they are not alone, that they do not have to journey this difficult journey on this side of heaven at times for a lot of people, that they don't have to be alone and that they can have someone accompany them. They can have someone who is going to listen to them, to see them, to, quite frankly, just be with them. And yeah, there's so much I could say about that, but I guess I'll land my plane.
No, that's great. Yeah. So it's an encounter with the gospel, right?
Absolutely.
Even if you're not specifically talking about scripture or faith, it's like they're experiencing that love, that support, that joy with you. And if they're
Absolutely.
looking for Catholic
Absolutely.
therapy, then you are talking about scripture and the gospel.
Oh, 100%. I
Yeah.
literally keep my Bible right by me. It is within arm's reach. I'm ready. I've got my tabs and everything. Let me tell you, game changer. Yeah, there are some like clients that will come in with really heavy and quite frankly distorted thoughts. And I'm like, whoa, this is not the truth of who you are. I'm sorry that you have been led to believe that. But let's share the truth about who you are, who you belong to, and where your true identity can really be found.
That's great. Wow. That's awesome. So I guess I have a question in mind, but I'm going to ask another one first.
Yeah,
But if someone's
totally.
coming to you who's not faith-based, right? And how does that change things? You have a lot of people who want that faith-based therapy, but then people might just be referred to you. What would be the difference, so to speak?
Yeah, absolutely. That's a great question. And honestly, the only difference would be if someone who is not faith based, we're not necessarily busting out scripture. We're not necessarily busting out scripture. But again, like even in that implicit way of sharing the love of the Lord, like without necessarily bringing in God, but through my actions and saying they're worthy, they matter, and they are good. There's been one major theme that I feel like I've been seeing with clients recently, and that is this idea that they are alone. Like, oh my gosh, Danielle, I thought I was the only one struggling with this, or I think I'm the only one going through this. I'm like, whoa, whoa, whoa. Let's break that down a little bit. Let's bust out some self compassion. Those three variables, according to Dr. Kristen Neff, we've got self kindness, mindfulness, and common humanity. And I'm like, okay, we're going to be talking about common humanity, even if I've got to really reinforce it into their heads. I'm like, you are not alone. I mean, even thinking about Jesus, in a way, was really abandoned, quite frankly, by most of his disciples, but there were people like his mother, who were there with him, or, Mary Magdalene, or, John as well. Even if we don't necessarily have a Mary Magdalene or Mama Mary or John in our lives who are with us at our cross that we're experiencing. If I'm allowed, I'm honored to be that person, to really be with them in their moments of suffering. It is heavy, but the reality is when clients also say, like, Danielle, I feel better after session, or I'm feeling lighter after having talked to you. Like, the first thing I say, well, thank you for sharing that with me, but praise be God too. All the glory and honor and praise to Him, because that really just shows the power of accompaniment. That shows the testament. And we don't heal in isolation, we heal in relationship. And that's exactly what I hope and aspire to do, is to just be in relationship, obviously appropriate, with my clients. And I'm
Therapeutic
like,
relationship.
yeah, therapeutic relationship. That's exactly it.
No, but that's beautiful. I love how you frame that, where no matter what, you are just being that instrument of love and joy and reminding people that they are not alone, that they don't have to be alone, and that there is this shared
Absolutely.
experience. And so they really aren't alone, even if they feel alone, which is just, it's
Absolutely.
so common. And even in our loneliness, that loneliness points back to the Lord. It's the Lord saying, hey, I'm here, come to me. So there's something in the loneliness that points us back to Him. But so if someone sits down with you for the first time in therapy, what do you want them to know about the process? Like expectations for you. And this could be as practical as how long are sessions or how frequent, but also what is therapy? If they're just like, I don't know what this looks like, what do you want them to know?
Yeah, well, I did have a really great supervisor. You
Oh,
said, and
stop.
it was ingrained in my head, that therapy is about building a relationship with yourself. And truly, that is something that I will tell every single client in the first intake session. Before I do that, something that I like to share with clients earlier in that initial intake session is, just as one of my professors in grad school said, we are in the business of emotion. And so, being in the business of emotion, it could be really difficult, because when someone's coming to therapy, my job is to challenge the system. My job is to, like, in a way, kind of like assess and shake things up, because obviously they weren't working. So when we try to make change, it can feel really uncomfortable. I make sure to tell clients in that first session, you are probably going to be leaving some sessions and not feeling so great, way worse than what you did when you came in. But that is not my goal every single time. I want you to leave sessions feeling empowered, confident, capable, knowing, okay, with Danielle, I'm building my toolkit. I know that she is cheering me on, even if she's not there with me. And that's what I want them to know too. It can feel a little bit uncomfortable at the beginning, quite frankly. I don't know if you've ever had acne as a teen. I'm 32 and I still struggle with it from time to time. I'll never forget the dermatologist saying, well, Danielle, it's got to get worse before it gets better. And I'm like, ugh, ugh. And so I'm not saying it has to get worse, but it kind of might feel like that.
I like the analogy of taking off the Band-Aid. Sometimes we need surgery. So there's an open wound.
Yeah.
We're taking off a teeny tiny Band-Aid. It's flapping in the wind. It's not even doing anything. We have to clean this up. We might even have to go into it. That can be painful. That's a brutal analogy, but there's something to it. The coping defense mechanisms that people have, in some ways, we're peeling that back and saying, what's under here? How did you get hurt? What's at the core of this? And so there are times where therapy can be hard, right? What you're even describing is like the informed consent. It's like you want people to
Exactly.
know, like, you are consenting to hard work at times, but also
Mhm.
empowerment, support, peace, and tools. But this can be hard because we're talking about real wounds. I've had that too, where I'm working with clients and maybe 3 or 4 sessions in, they're like, Adam, I feel more depressed right now because, yeah, well, we just uncovered some trauma that hasn't been addressed in maybe 40 years. And so now we're
Mhm.
facing it. This is a grief, like you're feeling it. It's actually good that you're feeling it. And we want you to have tools and to feel it well and to have support, but you're doing it. It's like you're running the race and you're feeling the burn, but you're doing it.
Yeah.
And this is what healing involves. So it's about relationship. It's about realizing this is hard work.
But the beautiful thing, yeah, is that they're not doing it alone. Just like with me and my personality, you will see me clapping for my clients. You'll see me throw my hands up in the air because I just get so excited. I have these new headphones and I don't know what happens per se, but sometimes like when I like log into session with clients, I'll be like waving, super excited, hi, so and so. And they're like, Danielle, we can't hear you. I'm like, oh my gosh, you got to be kidding me. I'm like, spent all this money on these darn things. One client, she's so cute. She said, Danielle, I think why it has a hard time connecting is because you just get so excited and you're so joyful. And I'm like, you know what? We're going to go with that. She's like, it just can't keep up.
Your joy frequency cancels out the mic. It can't pick it up.
That's exactly it. I think that's totally it. And we're going to go with that. My
It's just
joy
Bluetooth.
frequency. Yeah,
Yeah, it's just the Bluetooth. Awesome.
exactly.
So,
Go ahead.
I was just going to ask anyone working with you, how long are sessions? How, like the frequency, like what could they expect? And I know that's pretty variable. How many sessions? Is it more than a handful? Like ranges.
Sure. Oh,
Yeah.
totally. Absolutely. So, what I recommend normally is I like to discuss frequency of session with clients at the end of the intake, because that way it gives me an opportunity to assess how severe are their symptoms. What is the like level of impairment in their lives that contribute to their lack of overall functioning. If that's pretty high, then I would personally recommend at the beginning, at least, being more frequent. So that typical kind of industry standard would be like once a week. I mean, God forbid, it has to be twice a week if it's like really emergent. Ideally, once a week. And from there, if the client starts to progress and gets better, their level of impairment is decreasing, then we can totally scale back if needed. Some clients are bi-weekly. Again, I'm okay with that if that's something they're okay with. I actually even have some clients too that are actually just like once a month. And that I would say is probably because of cost. And like, I totally understand that when my job as a therapist is to meet my client where they're at. And that even means financially too. Like, hey, if you can only do once a month, absolutely let me help you once a month. Also trying to just like be aware of that fact that, things are kind of hard, like tariffs and everything. I'm truly honored to continue to walk alongside of my clients that still like show up and put the work in too. Like even when it can be really difficult, whether that's emotionally or financially, they are willing to do this. And that demonstrates their level of commitment. And I am just blown away by that.
Yeah, for sure. That's great. And it is a real investment, right? Like you're saying, like in time and money and
Mhm.
emotional energy in someone's life.
Absolutely.
But the
Absolutely.
payoff is healing, right? Is transformation, is better
Mhm.
relationships, right? Better, more peace
Absolutely.
on a regular basis. And so
Absolutely.
that's huge. Yeah. And you said sessions are 45 minutes
Oh, yeah,
ish.
I know. I completely because I didn't answer that.
No,
Yeah.
you're good.
Ideally, like 45 to 50 minutes. I'm not gonna lie. Sometimes I can kind of go over it because I just get so excited and into it. So, I'm like, let's keep going. But I know I need to be better at setting boundaries. To kind of answer your other question, is how many sessions is it like a handful? Well, that's actually really dependent upon the person, dependent upon like their struggle. My goal is to work myself out of a job. I want to help as many people to let them know that they can handle life stressors so that they don't essentially need me anymore. Will that ever happen? I don't know. We kind of live in a broken world. But ideally, it really is just dependent on person to person, case by case. I mean, I can't say after a first meeting, I think you need 8 sessions. I think you need 16. It certainly does not work that way, nor will it ever work that way. If somebody tells you need 8 sessions, then peace out, run.
I can fix
Because
you in
I'm like,
10 sessions.
oh, like
Yeah,
who
run.
said run for the hills is all I gotta say. And knowing that session frequency is always being reassessed. Like, how are you feeling about this month? When it comes to scheduling for the next month, that's when I really ask clients, how are you feeling? Like just this past month, a lot of people were being seen weekly, but then we scaled back to bi-weekly. I'm okay with that because they have improved in their overall functioning. This is what we want. I certainly do not want people to be dependent on me either. That's another line that, yeah, it's like you don't want to cross that.
That's great to know. I like hearing what you're sharing about. You check in with clients. Like, how are you feeling? Where are you at? What do you need? maybe that's more sessions for time, and then maybe it's scaling back. And, so there's so
Absolutely.
many options, right? Where it's not set in
Mhm.
stone. It's not a rigid thing that you have to
It is
stick to.
not by any way, shape, or form. And like I tell all of my clients, we're flexible here in therapy land. We do not abide by rigid rules. If you want to start off weekly, you feel great. You want to go to bi-weekly, you want to go to once a month, and then God forbid something happens and you need more sessions, we can do that too. At the same time, I also very much want to follow the lead of the client and meet them where they're at during whatever season of life they're in. They might be doing so good for a number of months, and then, God forbid, tragedy happens and they need a little bit more help during that time.
I have clients frequently that I saw a couple years ago. We wrapped up therapy and things were good. And then something happens in their life and they're like, hey, I need more support. So I come back and
Absolutely.
they come back for a time. And then when they're ready, we wrap up
Mhm.
again. Right. And the door's just, it's open. It's there. It's actually nice when people reach back out because it's like, oh, so good to hear from you. Of course we can meet. How are you doing? So that's like a little mini reunion. Usually when it happens, it's like, wow, good to see
Yeah.
you. It's been a couple of years. How can I help you? But I want to ask too, when people come to therapy with you, what kind of interventions or modalities do you use or integrate in the session with clients?
I'm not a purist by any way, shape, or form in any way. Tactic. I think as most folks are, most clinicians are. Honestly, this, I will preface this. My number one modality that beats off any of the rest is the therapeutic alliance. Like I want to make that like nice and clear. And that's also what research has demonstrated is that it doesn't matter if you're using CBT or another modality, it's the therapeutic alliance that provides like the most healing, which goes to support the other point that I made earlier in our talk so far is that relationships are healing. What works for some clients might not work for everybody. So we're also like super flexible with interventions as well. A lot of stuff that I pull from would be a little bit of CBT in the beginning, especially if they're struggling more with anxiety or anxious thoughts. I'm like, okay, what kind of thought is that? Is that we're catastrophizing here? And then I really, if they're willing, but I actually really love, and it's thanks to you too, Adam, is internal family systems. And I know you kind of mentioned and talked about that too. So that's really been powerful and incredible to watch and to bear witness to. And it really, I feel like, meshes well with anything compassion focused related. I want to really remind clients too that, hey, like, you've been really hard on yourself. That's not working for you. Is that working for you? Is that helpful for you? Most of the time, obviously, they're going to say no. So it's like, well, let's do something different. It's okay to extend more compassion to yourself without going too much into it. A little bit of CBT, definitely compassion is sprinkled throughout all of my sessions. Internal family systems. I do love a good empty chair intervention.
Can you describe that for people who might not know what it is?
Oh
What
my
is the
gosh,
empty chair?
totally. Oh, I know. Absolutely. The empty chair comes to us from Gestalt therapy. What we can do is really powerful is if there's someone in your life, whether alive or not, if they have passed on, and there's maybe some sort of unleft business or anything that hasn't maybe been said, we can put that person in an empty chair. I literally have clients put up the chair, like bring in the chair.
Where are they?
And some people will even put a picture of the person in the chair. Some people don't put a picture in the chair and they can vividly describe them to me. The more descriptive you can be, the better. It's really just an opportunity for the client to have some closure in an area of life where they might not have felt that they've had that. The folks that I've done it with throughout my time as a clinician, I've had a client put their dad in the empty chair. I've had people put ex partners in the empty chair. And yeah, it's also very incredible to bear witness to. Very, very emotionally heavy experience intervention, but that's exactly what it is. It's experiential and it really allows the person to say whatever it is that they need to say, knowing that it is a safe space and that the other person isn't going to chew their head off, right away. And so it really does kind of provide a safe containment, a safe environment for them to do so. And we can go as slow as they need or do it over a couple of sessions. I mean, wherever the client is, I have another client, she's just like all of my clients are so sweet. I love them all so very much. But she's so gracious to me and she's like, Danielle, I need you to go a little bit slow. Absolutely, of course. I just get so excited. I'm like, we are on a roll. But I have to remember, too, as I said in the beginning, we're in the business of emotion, and talking about that can be incredibly difficult. Whether it's you telling me we're going slow or the client telling me that they need a little bit more of this or that, I'm totally happy to do so. I kid you not. We really are flexible in therapy land here.
Yeah, that's great. And I love the empty chair, even with internal family systems, which you were mentioning. It's pretty similar to like instead of your dad, right? Imagining your dad as they like to put like your child self in that chair, right?
Oh
Or
my gosh,
yeah,
exactly.
so yeah, that's a great glimpse of what happens. This work really feels like a vocation, right? You feel called
Oh,
to it,
totally.
and you're bringing that joy and the truth of the gospel into this work. Who do you feel most called to work with? Are there any
Mm.
types of clients struggling with different crosses they're carrying? Who do you feel most called to? Maybe it's just everybody, but anybody that stands out.
Well, I'm a little bit biased because I know what it's like to struggle with my own anxiety. So I definitely have a big heart. I mean, obviously for everybody, but a little bit bigger onto anxiety, because gosh, I know how paralyzing it can be. I know how life disrupting it can be. However, what I've really noticed too on my caseload, and maybe it's because we're the Catholic Therapy Center, so they're like, we're going to go there. But a lot of folks with scrupulosity as well. And so those cases, wow, they're definitely a challenge, but they are also so incredibly powerful to witness when they have those epiphany moments. They really are able to implement the changes and realize God still loves me for who I am, just as I am. And I can learn to trust his mercy and that it's not just for the select few. In fact, it is actually meant for me. And so, yeah, I would say anxiety and just kind of, I think maybe by default, some scrupulosity too. Like it can be both very challenging, but at the same time, like, wow, both very honored to walk with those folks. I mean, quite frankly, anybody as well, too.
Yeah, that's great to hear. And that's coming from your experiences, right? Your personal
Yeah,
experience, professional
absolutely.
experiences. Yeah. Wow, that's great. A random question that came up for me. Do you assign homework? Like what does it look like in between
Love
sessions?
it.
Like
I
some
love
therapists
that
do, some
question.
don't.
So I definitely do assign. I don't call it homework because I remember getting homework in schools. Like I certainly like have like kind of like visceral response to that. But I actually like to call it a challenge. And so if you are one of my clients, you will know that I will say, let's collaborate on your challenge or what do you want your challenge to be? Sometimes, depending on the session, I will assign the challenge based on what we've talked about. Or sometimes I really, most of the time, ideally, actually really like it to be a collaborative affair. Like, what does the client want to work on between now and the next session based on what we talked about? I literally say it just like that. I'm like, what do you want to work on between now and our next session? And so they'll provide me with the starting point, and then I'm like, if it needs to be finessed out a little bit more, I'll say, like, oh, okay, well, let's kind of quantify that. Or how many times do you want to practice that? Or how many times do you want to track your mood? And so, again, that's why it's really a collaborative approach, not only with the challenge, but with the entire process of therapy in general. Am I a stickler on making sure you do your challenge? Probably not. I do like to review it, but you're not going to be reprimanded if you didn't. This is not an academic setting. This is a relational healing setting. And that's actually what I really like because, especially for clients who maybe are scrupulous or more perfectionistic, if they didn't do it and I'm not reprimanding them or there's no consequence, like how healing is that? How profound is it for them to say, okay, I maybe didn't do something that I know I was supposed to do, or I didn't do it all the way, but Danielle still accepts me. She still wants to help me. Again, I think it goes to our earlier point of, hey, I'm just trying to spread the love of the Lord and acceptance of people as well. But again, I will kind of also say too, I'm like, well, challenges are for your benefit. So take what you want, don't take what you don't want.
No, I love that. Sometimes the best homework is failing the homework, still
Absolutely.
experiencing that love and support. Like, yeah, it was really
100.
challenging. Okay, awesome. Let's unpack that. Sometimes that's more fruitful than, yeah, I did it perfectly and, I got it
Yeah,
done.
exactly. And if I could say one thing too about sessions with me personally, I tell my clients all the time, I am never, ever looking for perfection, only progress. And progress looks radically different for every single person. If some person is struggling to get out of bed and one day out of the week they get out of bed, that's a major win to me. If someone's trying to be really perfectionistic and they allow themselves to make a mistake, it's a major win. I don't ever want my clients to feel that they're going to disappoint me. You want the best for them. And I'll say, okay, well, did you think about it this way or that way? Maybe. Okay. Like, absolutely. I'm not going to have them walk off the edge by themselves. Absolutely not. But I want them to know we're only looking for progress. Progress looks different for everyone. At the end of the day, everyone is absolutely accepted. And I hope that with every single client I encounter, that they know how much they are loved, cared for, and seen by me.
Yeah. Yeah. That's beautiful. Man. So I'm hearing that mix of joy, truth, love, challenge,
Mm,
but support and compassion, not judgment, but still encouragement to grow. I mean, there's so much there. And
absolutely.
what do you want clients to walk away from therapy with? I know that's so personal and so different for everybody, but what are you hoping for in their time with you?
Absolutely. Two things. I'll share something, and then I have a book from one of my favorite spiritual authors, Henri Nouwen, that I'd like to read about that. I think he sums it up great. And that is to know that they are capable. Like, I want every client to walk away knowing that they can do this. Yes, life is hard. Yes, anxiety is hard. Yes, scrupulosity is hard, or any struggle is really difficult. But remember, it's not about getting rid of it per se. It is about changing the way that we interact with those struggles and those impairments. And it's really about resting in our true identity. And that identity is being the beloved of our Heavenly Father. And again, to know that they can be brave, that they can take one step in front of the other, even if it feels like they're shaking, but knowing that they can do this. As a therapist, I'm really trying to empower them, to lift them up, to encourage them. And I think, yeah, Henry Nouwen, he says it best. It's actually kind of crazy. I didn't know if I was going to share this quote or not, but from the life of the beloved. And so I have it right here. He says, these feelings, strong as they might be, are not telling me the truth about myself. The truth, even though I cannot feel it right now, is that I am a chosen child of God, precious in God's eyes, called the beloved from all eternity, and held safe in an everlasting embrace. So even when those feelings are trying to tell you that I'm a failure, I'm this, I'm that, like, no, like, even though you can't see past that right now, you can choose to rest in the fact that you are God's beloved, precious in his eyes, no matter what.
Wow, that's beautiful. I love that. Love hearing that. Thank you, Danielle. That like I needed to hear that
Course.
today too. Like,
Oh,
we
no, I'll
just
send it to
received
you.
that.
Of course. That's exactly what I want my clients to ultimately walk away with from every single session.
Yeah. So they are capable and they are beloved. Yeah. To
Absolutely.
have
And
that
more
security.
importantly, they can be brave in doing so by embracing this beautiful reality, despite what the culture or other relationships in their life might have told them, or what other sort of lies that they might have really grasped onto and kind of held as truth.
Yeah. And I think that's what was standing out to me too is when you're reading that and sharing that there really are these underlying different modalities, call them different things, right? Like identity lies or burdens, core
Mhm.
beliefs that we're carrying So this process of therapy is really seeking to understand, what am I believing about myself that is causing this discontent, despair, dysfunction in my life, a disorder in my life. And so the more we can understand that with compassion, and by God into that too, and that changes how we feel and that changes how we live. So really, again, going
Absolutely.
and doing what can be hard work, but is really fruitful and even joyful work as well. It allows us to experience that healing.
And there's so much, yeah, there's so much too. Again, like another big component for me too is acceptance and surrender, as well. Like that's a big topic. I feel like almost every session kind of comes up in some way, shape, or form. But all of that goes back to how I want my clients to leave every single session. And that's by that Henri Nouwen quote right there.
Danielle, I really appreciate hearing this. And it's, man, I'm like, wow, therapy with you sounds great. Sign me up.
My gosh, I'm honored.
But I think just experiencing the joy, the compassion that you're offering is really refreshing, and just that support that everyone needs. So where can people find you? How do people get in contact with you if they have any questions?
Yeah, absolutely. You can email me or reach out through the Catholic Therapy website. Emmaus is really great at forwarding those to me. I'd say reach out to the Catholic Therapy Center and they'll put you in contact with me.
Awesome. CatholicTherapyCenter.com. And then if anybody has any comments, questions for Danielle, please leave them below or reach out to us. You can get in contact with myself or Danielle for any other information at all. And Danielle has some other great podcasts we've done on ACT, anxiety. Maybe that's it. So
Yes. Yes.
yeah, great. Well, thank you so much, Danielle, for being here and sharing about what it's like. This really does give us a glimpse of therapy with you, and awesome, solid Catholic therapy, right? That integration is so important. So thanks for that. And then, yeah, if anybody watching has any questions, please feel free to reach out. Thank you for tuning in today, and hopefully we'll see you next time. God bless.